Hello, my guest today is Rick Olderman. Rick is a sports and orthopedic physical therapist, a personal trainer, a Pilates instructor, and speaker. Rick, welcome to the show.
Thank you. Thanks for having me.
Yeah, my pleasure. Really glad you're here. I want to dig in and talk to you about the over 50 pain management. But before we get there, tell us a little bit about yourself. How did you get interested in this line of work?
Well, when I was younger, I suffered some back pain and I happened to be volunteering at a physical therapy clinic at the time. And one of the physical therapists there saw that I was having some pain. So he treated me and all my pain went away. And I thought, wow, that's amazing. But it came back a couple weeks ago later. And so I'm just like, well, there must be something I'm doing that's causing this to happen. And so I decided to go ahead and go to PT school. So I thought, oh, I'm going to just learn how to figure this out myself. But what PT school focuses on is more the structures that are painful, not so much why they're painful. And it turns out that is the key to solving more chronic pain. And that bore out my first year after PT school in a sports orthopedic clinic. I could get simple things better, like post-surgery and sprains and strains and things like that. But anything that was difficult, like back pain, hip pain, chronic neck pain, headaches, things like that, I was not very good at. And so I really had a choice. And I didn't want to be one of those mediocre people physical therapists who just help some people and are satisfied with not helping others. I felt if I'm going to do this, I want to do it right. And so that's when I went into my real education about how all of this is put together. And that's what I've been doing for the past 25 years.
Okay, so let's unpack a little bit about that of this. I think that's really fascinating the way you mentioned, hey, I had some back pain myself, and that kind of got me interested in this field. And I think what you're describing is you went to school. Of course, you would necessarily need to know all the structures, right? I need to know my basic
Hmm.
anatomy and things like that, how these things work.
Yeah.
But you had this experience, it sounds like, and I think there's a correlation with modern medicine here, where if you got an acute injury, you're pretty good at that, right? Somebody sprained something or they've broken something and they want to rehab. You found
Yeah.
that you had good success there, but not so much with the folks coming in with chronic pain. And I think this is pretty common in our Western medicine, right? Is we're really good at treating symptoms. So somebody could come to, say, a physical therapist and have some sort of back pain, let's just say. They get some sort of, or maybe they go to a chiropractor, right? They get some sort of adjustment, they get some exercises, and they feel great until they don't a couple weeks later, right? So talk a little bit about that practice. And in the field of physical therapy, is that something changing? Are we seeing more and more people moving into this treating causality as opposed to treating symptoms?
No, unfortunately. I think we're actually going away from it, to be honest.
Mm.
The push in physical therapy right now is to do more manual therapy, manipulations, and things like that. And so that does not solve systemic problems, which is why there is chronic pain. And so one of the whole approach to training in medicine is you're absolutely right. We have to understand what the structures are, right? But I think we've confused with understanding what the structure is that's painful with the cause of the pain. So what we need to do is not only understand what structures are painful, but really the question is, why are those structures painful? And that was not really taught in my school. Based on all the therapists that I've trained out, since then, it's not being taught in their schools either. And so this gets into what I call component thinking. In medicine, we are trained to look at components of things, drill down deeply into a structure, take the MRIs, know exactly what the structure is, but we're not trained to understand things from a systems standpoint. So there's nothing that's pulling us back and saying, oh, this is how all that fits into the big picture of how we function as humans. And so that's what I've been putting together these last, many years.
Yeah, so you've had, yeah, like you said, you got 25 years of experience in this and trial and error, I'm sure. So I think that's interesting that you talk about component thinking versus this systems thinking. And I've heard you say in some of your other media, solve the why, solve your pain, right?
Exactly.
And it's a little
Yes.
disheartening. I'm kind of expecting you to say, "Yeah, that my field is really rallying around this. Let's find the cause and let's treat that
Right.
as opposed to treating the symptom." But it sounds like maybe not so much. And I hear that from other doctors, physicians, physical therapists, folks that come on this show. They're saying, "Look, my formal training didn't give me the tools I need to treat these root causes." Right. So let's talk a little bit about these root causes. What are some of the more common
Yes.
causes of pain? I know that's a big topic,
Okay.
right?
So yeah, it is. So let's drill down into one type of pain, maybe back pain, since that's the most common problem that we face as therapists. And probably your listeners, most of them have back pain of some sort or have dealt with it. So I can take, I can talk about it, but it's best if you can feel it. And so if you don't mind, what I'd like to do is take you through a test to feel what back pain and the cause is. Would that be
Sure.
okay with you?
Absolutely.
Okay.
Yeah, let's do
So
it.
do you have back pain yourself, Kevin,
I no,
or
fortunately, I
no?
do not. Now, I certainly have,
Oh, okay.
but I no. Yep.
Okay. All right. Okay. So for your listeners, what I'd like your listeners to do right now is lie down on the floor on your back, and you can lie out on the couch. You can lie in your bed, whatever is easiest for you to do. And I want your legs to be straight when you're lying on that floor. And so, and really, again, we could talk about all of these things happening, but if you don't feel it in your body, you won't really know it. And so this is about knowing a basic truth about what's happening with your spine. So now that you're lying on the floor with your legs straight, I want you to feel how your back feels, your low back feels like this. Okay, you spent a few seconds there. Now what I'd like you to do is bend your knees so your feet are flat on the floor. And if it feels better, then hug your knees to your chest instead. So whatever feels, good for you. And then now the question is, does your back feel better with your legs straight or with your knees bent? 99% of the people listening to this are going to say, oh, my back feels much better when my knees are bent or when I'm hugging them to my chest in some way, something like that. So the question then is why? And so if you straighten your legs back out again, you're going to feel that your low back is arched a little bit more off the floor than when your knees are bent. When your knees are bent, your back is flatter to the floor. This is a fundamental shape issue that's causing a lot of back pain. I call it an extension problem, but essentially it means that there is either too much arch in the back or there are too many forces trying to pull the arch into the back. Or yeah. So even if you have a disc herniation, a disc bulge, stenosis, spondylolisthesis, any of these diagnoses, if your back feels better with your knees bent, we haven't changed the structures of any of those diagnoses. All of those things still exist in you, but your back feels better when your knees are bent. So this is telling you that your back pain isn't necessarily due to those structural anomalies. What it's really due to are the forces acting on your back. All right. So the forces in this particular case are those that are trying to pull the back into more of an arch. All right. So it would be, Kevin, like me, if I tied a rope around your waist and I was pulling really hard on you, right? Trying to pull you forward and you were resisting me. So you're not changing, how you're standing or anything, but you're too strong for me to pull that rope. It doesn't mean I'm not exerting force on your back though. It just means that you're not moving. And the same thing with this test. It's not that your back is too arched. It's that you have too many forces trying to pull it into an arch. Does that make sense?
It does. Yeah. And
Okay.
I
So, so,
yep.
so let me
Keep
take
going.
this
I've got
to the
questions, but
next.
keep going. Yeah.
Yeah. Yeah. So let me take it to the next step. So what is a really common problem that we're all doing maybe that is contributing to this idea of too many forces pulling the back into an arch? So Kevin, I think you're standing right now, right?
I am. Yeah.
Okay. And if all your listeners could now stand up, all right, I would like everyone to stand up and just listen to the podcast. So while you're standing there, I want you to notice, and Kevin, you too, are your knees straight or, or are they locked backwards or straight like that? Are they locked into a straight position? And so now, if they are, now I want you to unlock your knees and soften them just a little bit. All right. And I want you to feel what that does to your low back area. All right. Now, Kevin, you're not having back pain, so you won't feel a huge difference, but you'll feel it with my next instruction. So all of you now are listening are standing with your knees soft. Now I want you to straighten your knees again. What just happened to your low back when you straighten your knees rather than soften them? What happened with you,
Yeah,
Kevin?
I can definitely feel a tension. I stand most of the day and I stand with soft knees, but when I
Right.
lock out, I can definitely
Good.
feel that tightness right in my low back. It's just a
Right.
subtle change, but
And
certainly, yep, I see where you're going.
exactly. Ex- exactly. So locking the knees causes the back to arch more, which then is increasing and creating that tension that you're now feeling in your low back, even though you don't have back pain. You can feel that there's more tension there. So this is a very common problem that we have in our society, that people stand and walk with locked knees or straight knees. And so if your back felt worse with your legs straight on the floor, and that you just found that your back feels better when it's flatter, softening the knees makes your back flatter throughout the day and takes away one of the largest forces that's acting on that low back, creating that excessive arch. It's an easy thing to do. I had a collegiate swimmer with 15 years of back pain. No one could solve it, blah, blah, blah. She was in so much pain, I couldn't do anything else other than ask her to soften her knees. 15 years of pain. In 3 days, she was 75% better. This
Wow.
is so common. It's that big of a force acting on the body. Okay. So that is one common pattern that's causing back pain. And it's usually central back pain. There's another common pattern. We can get into that if you want to, that causes unilateral back pain, pain on one side or sciatica or SI joint pain, things like that. So
Yeah, so that's very interesting. I kind of thought maybe where you were going to go with that was sitting, but it's more that standing in that locked position. And like you said, we just went through that very simple exercise. And while I'm blessed with a very healthy back right now, I could certainly feel the difference there. Take a minute and talk about sitting because I think that, we have two in our culture today. We have two very common postures. One is standing and the other is sitting. How does sitting contribute to pain, whether that's back pain or neck pain or other types of pain?
sure. Well, again, it depends on the type of pattern that's causing your pain. So let's go back to this test I just did for the back. Those of you who did the test found that, oh yeah, my back hurts more when it's more arched. It feels better, even slightly, when my knees are soft or when my back is flatter. So now we take this same pattern to sitting. Most people who sit at the front edge of their chair. Most
Mm.
chairs are built too big for most people. They're too deep. And so they don't use the backs of their chairs, or their computer is sitting too far in front of them their eyes can't see the screen well. So they scoot forward in their chair and lean forward to do all their typing. And so nothing is supported in the spine. Usually when we sit forward in a chair, it then causes our pelvis to tilt forward into what we call an anterior pelvic tilt in physical therapy. And when the pelvis tilts forward, and you can even try this now, if you lock your knees again while standing, you'll feel your pelvis is tilting forward to create that back arch in your back. And when you unlock your knees, your pelvis relaxes that tilt. You don't necessarily have to tilt it backwards, but you just have to not tilt it forward to feel relief while you're standing. And the same thing with sitting. So if you're sitting forward at the edge of your chair typing, then you're sitting usually in this arched position with your pelvis tilted forward, which is then again contributing to that back flattening or arching, I mean. So a
Right.
really common recommendation I make to people is simply just get a couple bed pillows, shove them in the back of your chair so that to bring the back of the chair to your back, right? And then, because if you feel you need to sit at the front of the chair, well, me trying to get you to sit to the back of your chair isn't going to work because you've already figured out that you have to sit at the front of your chair. So let's bring the back of the chair forward to you instead. And so you shove those pillows in there and now you'll feel, and you want to do it lengthways. So now your whole back is getting this input that, oh, I have something I can relax into. That alone, I had a woman one day cry from happiness when I just gave her that recommendation, she had so much pain with sitting. And when she learned that she could actually have her chair support her, that was a world changer for her. So the other way to help this, like a lot of, especially shorter people, most chairs are too tall for shorter people. So the other thing that you can do is just put a couple books underneath your feet. And what that's going to do is going to
Mm.
tilt that pelvis back ever so slightly to flatten that back a little bit more. But if you don't have the pillows there for your back to flatten into and rest against, then you're going to create more stress in your system because now something's pushing you back. You feel you have to be forward, and now you've created all this tension. So one of the things I love doing with my patients is showing them how their workspace should be like a cocoon where you're fully supported, you're relaxed while you're working. And then we can get
Yeah,
into the
fully.
aspect of stress in terms of creating this pattern too, since we're talking about work, if you want to.
Yeah, so that yeah, I definitely want to get into to the stress a little bit. So, but just staying with this workplace ergonomics, because most of us, let's face it, we have jobs where we sit most of the day. And to your
Sure.
point, we're
Yeah.
sitting probably in this unhealthy posture. We're leaning forward, but I suspect also that most of us on a keyboard are hunched over, right? So we spend a lot of time on our phones. We spend a lot of time on keyboards, and it seems to me with those, we've talked about that low and mid back, right? So if we support that, maybe even bring our feet up and support our back, we've got a little better posture there. But if we're still in that hunched over shoulder position, that can't be good for us, right? Is that I would suspect that that can't be good maybe for neck pain, upper back pain. Is there something that we can do to improve that posture?
Correct. So hunching over is more of an upper body system issue rather than a lower body and back system issue. So looking at that, so let me back up just a second so that people understand where I'm coming from with all of this upper body system stuff. Okay. So I've got a little skeleton here, and this is what I use to educate my patients. And so if we look at the upper body system, we see, first of all, that we have this shoulder blade here. And the architecture of that shoulder blade, there's only one other bone in the body that looks like this, and it's a pelvic bone. All
Yeah.
right. We know that the pelvis is the center of our movement for our lower body system. Just the same, the scapula or the shoulder blade is the center of movement for our whole upper body system. So there are muscles that blossom out from the scapula, attaching into the base of the skull, the neck, and of course the shoulder joint and so forth. So there are rules about how this should be resting and moving. And if those rules are broken, that's when we have a lot of shoulder, neck pain, headaches, and so forth. All right, because of these attachments into the neck and head and so forth. So when we talk about ergonomic sitting, typically the most common problem that is happening that is causing pain in the upper body system is that the shoulder blades are resting too low. It's called depressed shoulders. Okay. And so when they are depressed, there are connections that go from the shoulder blade into the cervical spine and the base of the skull then that become strained because their job is to hold this system up. And now the shoulders are resting too low and it's causing dysfunction. So, and then also to your point, if you're sitting hunched, well, then your chest muscles are becoming short too. And then, so the chest muscles are another scapular depressor because they're angled kind of like this. So when they're contracted, they're going to be pulling things down. Okay. So the biggest help for most people, and again, this goes back to the chair. Most chairs are too big for people. So the best place for people's arms when they're working is with the elbow by their side and the elbow at midpoint where the seam is in the shirt. When your arm is there, my hand should be resting on the keyboard. If you're reaching forward or your elbows out to the side to reach for your keyboard, now you're using all of these neck and shoulder muscles to hold everything up all day long instead of your chair to hold things up for you. So what I typically do, especially for people whose chairs just are too big, and most chairs are, by the way, even though their arms adjust, they can't adjust well enough to support people's arms well enough. So again, I get our bed pillows and I fold them over in half and I shove them between the person and the arm of their chair on both sides, which then makes that arm right by their side now. And usually I prefer, especially if you have depressed shoulders, we have to support them. So I make sure that that pillow is like at half inch or an inch higher than the arm of their chair. So they'll feel like their shoulders are up a little bit, but what that's doing is completely unloading all of these connections into the neck and head. And it feels delicious if you have shoulder, neck pain, or headaches while you work, especially. This will be a big game changer for you.
Yeah, thanks for that. That's really interesting. I hadn't thought. I knew that, obviously I want my arm here. I want that 90 degrees. I think most workplaces don't really support that. I've got a nice stand-up desk where I can make that work for me. And I know that people can have the shoulder and the neck pain, but I hadn't really thought about headaches. But certainly I can see how if you're in that depressed shoulder blade and we're pulling down on this, that could certainly contribute to headaches. So if you're somebody that suffers from headaches and can't quite figure out why, it could be a simple ergonomic fix, kind of like you're explaining here, right?
Oh, I'll tell you this, Kevin. In the last 20 years, I've been treating headaches. I can't remember a patient where it was not the shoulder system as the cause of the headache.
Wow.
So if your
Yeah.
people who are listening are suffering from chronic headaches, usually their practitioners have been focusing on the neck or the
Yeah.
head, right? Suboccipital muscles, all the neck bones and everything like that. Almost no one is addressing the shoulder issues. And especially if you have a history of any kind of shoulder dysfunction, you need to go back and start solving the shoulder system and your headaches. I don't care if they're migraines, tension headaches, whatever. They will disappear once you fix the shoulder girdle system. And that's what you've been missing. And so,
Yeah.
and you bring up a good point about standing desks. Like a lot of people say, oh, well, I'll get a standing desk. Well, where's your arm support with a standing desk?
Yeah,
There
there
is none.
isn't. That's a good point. No.
S-
Yeah, it's my
So,
skeletal system,
so
right?
right. So you have to be more aware of your body while you're using a standing desk because of the lack of support, passive support that a chair might provide you.
Interesting. Yeah. Yeah, that's I hadn't thought of that in the sense of standing. I'm 100% supported by my skeletal muscular system, right? There is no outside environmental support for me there. And
Right.
just sticking with the shoulder girdle for a minute longer as a personal trainer, I'm sure you're a
Sure.
personal trainer as well. You probably see this in your folks that are over 50. One of the most common things I see is just that shoulder mobility. I can't do overhead presses because my left shoulder might just pick a shoulder or maybe both, right? And so I can't go overhead or it hurts when I go overhead. I have
Sure.
pain. I can't do lateral raises because it hurts this. So talk to us a little bit about, because I think that's pretty common for that over 40 folks. They start to lose that mobility. And I think the danger
Hmm.
there is just, it's that attitude of, well, I'm just getting older. So that's the way it is. And it's just all downhill from here. But we don't have to accept that, right? There are things that we can do. How do you work with folks that come to you with that shoulder pain? Is it more just looking at their day-to-day posture? What are you doing to get to that root cause and ultimately correction for that?
Yeah. So one of the things, this goes back to one of the things that you originally were talking about is your working posture. So if you're working like this, well, how can you not get tight shoulders? Right.
Yeah.
So I once treated a receptionist who had a rotator cuff tear because on her vacation, get this, on leaving for her vacation, she put her suitcase up in the overhead bin and tore her rotator cuff when she was leaving for vacation. Oh, and that's
Hmm.
because none of her life took her above shoulder. And now she adds a 20-pound load onto that. Her body was unprepared for that motion. All right.
Yeah.
So that's one way to start thinking about it is what am I doing throughout my day that's reinforcing this exercise that I think I want to do, this overhead exercise? Am I doing anything over my head, during the day? And so the way the body works is, when I ask people to do certain exercises, I always tell them, look, I'd rather you do this 1 or 2 reps 30 times a day than once for 60 reps. Because if we do it throughout the day, we're constantly teaching the body to release and lengthen and use muscles that are supposed to be used. But if you only do it one time a day, it's not going to change how your brain is controlling your body. Does that make sense?
It certainly does. Absolutely. Yeah.
Oh, okay. So then to go to back to your original question, then, well, the first thing I do with my patients, anyone who has a hard time getting their arm up overhead, typically it's because the shoulder blade isn't working well. Because one of the rules about the shoulder blade is when the arm is moving up overhead, this shoulder blade should be rotating 60 degrees to help it. If it's not rotating well, then what's going to happen is this arm bone right here is going to bump prematurely up into the top of the shoulder and restrict that motion. And therefore, pain or deterioration occurs. So one of the first things we need to do is starting to get this system going, getting the shoulder girdle system to move. And I don't put load in the hand when I do that because I mean this arm is about 10 pounds, itself, right? You don't need a
Hmm.
load, an extra load on top of that if you're trying to get this thing to move first. So that's
Yeah.
the
Okay.
most common, that's the basic way of thinking about this is, oh, I'm having problems here. And think of it this way. The shoulder blade is half of the shoulder joint, right? It houses
Yeah.
the socket. So if the socket isn't moving well, why should the rest of the arm move well? It doesn't.
It
And this is
doesn't.
what
No,
fixes
that's
it.
right. Gotcha. Okay. And again, that's going back to your root cause, right? We could say, hey, I've got this
Exactly.
shoulder mobility issue. Okay. But if we don't understand what it is that's at the root cause and then fundamentally how it got that way, what are the behaviors that we're doing? Because I think that's going to be the secret, right? Because you could
It
probably
is.
maybe relieve some of that pain or make it feel better temporarily. And, you hear about people with pain getting cortisone shots and things like this. But while that may have some benefit, it's not curing, quote unquote, curing the root cause, right? So we need to go back and do some
Right.
detective work and figure out what that root cause is. Now, before we go back and talk, I want to talk more about root causes, but you had mentioned a few minutes ago when we were talking about the workplace, the role of stress and pain, and I wanted to unpack that a little bit there. Where did you want to go with that when you mentioned the role of stress with pain specifically in that workplace?
Okay. So one of the patterns that we just talked about with back pain is arching the back, right? As a cause of more of that pattern of back pain. So when we are stressed, what that is, we are in a hyper state of alertness when we're stressed, right? So if you can imagine yourself walking out in the savannah in Africa, right? And you're alone suddenly, you're not going to be moping around, right? Just like, oh, whatever. No, you're going to be like, holy smokes, what's going on? You're going to be super erect in this position. Well, your back is arching in that situation. So when we're in stressful environments, one of our neurological reflexes that we're born with is called a Landau reflex. And that kicks in when we're stressed. And that is one of the things that causes us to arch our back more. So if you're in a highly stressed situation at work, you're going to be arching your back more, or at least engaging those arching muscles more because of that stress response that's hardwired into your body. The way it also works though, and like we were just talking about neck pain and headaches, the way it also works here is that stress will cause you to engage the muscles that are already typically shortened. And in the shoulder girdle system, it happens to be the depressors. All right. So stress, even though people say, "Oh, I feel pain up here," when I feel stress, the reason they're feeling pain up here is because their scapula are unsupported and everything is engaging. There's a little teeny tiny muscle that goes from the shoulder blade up to the C1, 2, 3, and 4 up here called the levator scapula. Levator means elevate, right? So its job is to elevate. But we've got much bigger muscles and gravity pulling everything down, not to mention your poor work ergonomics where your arms aren't supported. So now that levator scapula is working even harder and it becomes more painful. So a lot of people will report that, oh, when I get stressed, my shoulders go up like this. And I'm thinking, no, they're not going up. They're going down. You just feel that pain there. And so you think that your shoulders are rising because of that pain. It is not the case because the job of that little muscle is to elevate. It's trying to elevate, but your shoulders are too low. So that's how stress can play into some of these patterns. Does that make sense?
That does make sense, and thank you for sharing that. That's very interesting because I think a lot of us may, we're familiar with things like, oh, when I'm stressed, I carry my stress up here, and I'm pointing to my neck here for the folks listening,
Yeah.
or I get stress
Hmm.
headaches, and that role of stress, that especially chronic stress, which most of us now deal with, right? Bad on so many levels biologically, but physically as well, right? So now we're kind of learning that what this stress does, and it's causing those shoulder blades kind of backing down, and I'm really stressing those muscles, which is going to aggravate me further. And it sounds like I'm having this deferred pain where I'm describing the pain in my neck or I'm describing the pain in my head, but it's
Yes.
really kind of originating somewhere else. So again, it takes a little bit of detective work to get to these root causes, it sounds like. So let's Rick, let's kind of switch gears here and talk about what kind of modalities do you prescribe? What have you found to be the most successful? And obviously, it's going to be a little different for whatever area of the body we have pain in, but what sort of modalities are we using to address these root causes?
I don't use modalities in terms of external devices. So
Gotcha.
my whole approach is about fixing problems. And I can't fix a problem using some outside device. We weren't born with outside devices. Sometimes I'll use something to help me speed things up, but ultimately we've got to fix how we're using our bodies. That is the biggest payoff. Like that woman, that collegiate swimmer, just getting her to unlock her knees. That has, no amount of e-stim, acupuncture, dry needling, manipulation could have achieved that lasting effect other than her changing how she uses her body. And so that is the most powerful modality. And really the biggest, even more powerful than that, is someone's belief system. One of the things I get from a lot of therapists is, well, how do you get people to buy into all of this? Well, I get them to buy in because we always do test retest in my clinic. Hey, what hurts you? Show me how, what are you doing that's hurting? And then we do something. Okay, do that thing again. And they feel 50% less pain after we did some intervention. Okay, that intervention is what you're going to do at home. You better believe that someone is going to do that intervention because they now know it's better for them rather than giving a whole ton of exercises that don't really specifically address problems, right? So once I get someone's mind and belief behind what we're doing, game over, because they will do everything that's necessary, especially when I show them exactly what those things are that are necessary.
Yeah, okay. And I think when I meant modalities, I meant more or less devices or external things because I think that you'd mentioned dry needling and maybe massage, things like that are
Mm.
more of that symptom treatment. But when I say
Ah,
modalities, I mean more, are we working more in a mobility kind of work or flexibility or strength training, or is it a combination of these things? We've already mentioned just adjusting minor adjustments of posture, right? So
sure.
obviously that's one of the tools in your toolkit. But what I wanted
Yeah.
to see is because again, it's going to be different whether your person is complaining of neck pain, back pain, knee pain, etc. But are there some common things that you use to help folks? And what I'm trying to pull out is what are some things that our listeners today saying, okay, well, I've got neck pain, I've got back pain, I've got knee pain, and the sciatica is a big one, right? Are there some
Hmm.
common things, movement or postural adjustments that kind of universally help people?
Yes. So for instance, unlocking the knees. I can't emphasize how powerful that is to changing back pain if you have this pattern
Mm,
of dysfunction. Supporting your arms when you're working ergonomically is one of the most powerful things you can do right now today to change your neck pain or shoulder pain or headaches. All right. Putting
yeah.
a support, pillows behind your back when you're sitting, putting a couple books underneath your feet if you're on a shorter side and you feel like your chair might be a little bit too tall, moving the computer closer to you so you don't have to reach your arms. I had a guy with 20 years of neck pain on his right side, and we fixed everything, but his pain didn't change. And I said, wait a second, do you use a mouse when you work? He said, oh yeah. I said, where is that mouse when you're working? He says, oh, it's out here. I said, no,
Yeah.
you're going to move that mouse closer to you. And I want you to move your keyboard over a little bit because he does a lot of mouse work. So we biased the mouse to the center of his body. Neck pain gone that day.
Mm.
Never came back again.
Yeah. Wow.
So
Okay. Yeah.
that's this is how powerful understanding what your body is doing. That's how powerful it is to solve things. You don't need, I mean, yes, because of how you've used your body, there are muscles that will have become tighter and there are muscles that will have become weaker. For instance, if you tend to lock your knees, your butt muscles then turn off. All right. And your thigh muscles tend to become tighter. So yes, we'll then stretch your thigh muscles and get your butt muscles to turn on better. But ultimately, no matter how much stretching or strengthening we do, if I don't fix how you're walking or standing, all of that will be for naught. And you can work out at the gym for an hour, focusing on your butt muscles. But if you're not using them throughout the day, it won't help you.
Yeah, that's interesting. So, yeah, I think a lot of people, and again, going back to that sort of aging and that inevitability, and we have pains creep in, and certainly, those of us 50, 60 years old, we've had these repeated movement patterns and posture patterns. And to your point that, most of us are quad dominant and weak in the glutes, etc. And so we think, well, I'll go to the gym and I'll work out, which is way better than not doing that. But I suppose, let's say you go to the
Right.
gym 3 days a week for an hour at a time, that's 3 hours in your week. But if all of the other times you're, again, that locked out knees or that poor sitting posture, the shoulders kind of down, which is something I really hadn't considered, but my traps get tight. Often, and that's probably because I stand most of the day, and probably I am, when I'm not concentrating, those shoulders are falling down.
Unsupported.
So there, yeah, right. And so there's a lot of things to consider. So what's, I guess in terms of folks that are listening to this, we've already got some pretty good ideas how we can clean things up. But is it fair to say that most of our pain then comes just from our everyday posture and movement? Or I should say
Yes.
poor posture and poor movement? Okay.
Yes. And if you throw in emotional or psychological trauma, that now adds a battery that keeps your body locked in that neural
Mm,
tension pattern. All right. So that is yet another thing on top of this. Not all people have that, but if you do, I've just seen it so many times. It's one of the things that we have to unpack a little bit and show them. I'm not I'm not a mental therapist, but if I can show people how their trauma or anxiety or whatever has manifested in their body and then unlock that response in their body, that helps them unlock the response in their brain. It goes both ways. The brain changes the body, but the body also changes the brain. And I've seen it time and time again. So that is yet another issue that causes this. So, but you're absolutely right, Kevin. Ultimately, it comes down to how you're using your body. Your whole injury history, your exercise history,
mm.
your psychological history, it's all recorded here in your body. So all of it matters. And so I've just figured out over these 25 years how it's these patterns of dysfunction. So prior to owning my own physical therapy clinic, I figured out a lot of these patterns, but until I saw thousands of patients and saw a huge volume, was I able to see, oh my gosh, the same pattern of issues that's in Kevin is causing back pain, but that same pattern is causing sciatic pain in this person or SI joint pain in this person. But it's all the same pattern. And regardless of the diagnosis that you have, disc herniation, disc bulges, or whatever, the same pattern of issues is causing that because it's just based on your genetics, your history of how it plays out into your body. But they're
Yeah,
common
that's very,
dysfunctional patterns that we all have.
yeah, that's very well said. A common dysfunctional pattern. And again, since we're talking to an older audience, we're talking about decades potentially of these dysfunctional
Yes.
patterns. And that brings me to
Yeah.
another question here while you're mentioning these dysfunctional patterns. And that's not so much dysfunctional, I suppose, but this unilateral use. I'm thinking about my golfers, I'm thinking about my
Mm.
tennis players, these people that are in
Yes.
these, if you're really avid about these types of sports where you're really one side
Yes.
dominant, how might that play into chronic pain or pain relief?
I am so glad you asked that question. Because this brings up the second biggest pattern that most people fall into. All right. That causes almost if you have unilateral back pain or sciatic pain or SI joint pain, this is the pattern that you'll probably have. Can you see my skeleton okay here? My
I can see it
screen
fine.
is
Yeah, and so
frozen, so I
just real
can't
quick
see.
for folks,
Okay.
yeah,
Okay.
folks listening, just you could always hop over to the YouTube, but just so you know, Rick's got a model skeleton here, and it's kind of demoing this. So go ahead, Rick.
Yeah. So what you're getting into now is the second most common pattern that's occurring. And that is I call it a side bending pattern. That means that one side of the pelvis is sitting higher and the same side of the rib cage is often lower. And so you can see how that would be I would call that a side bending problem. So we would naturally get compression on that side where the pelvis is higher and the rib cage is lower of all the spinal nerve roots exiting that side of the spine that then comprise the sciatic nerve. All right. And in addition to this pattern, it also causes torsion in the pelvis that could create SI joint dysfunction and so forth. All right. Now, when you go to a practitioner, they will say, "Oh, you've got a rotated spine." And then they will try to fix your rotated spine. But what I have learned, I've never been able to fix a rotated spine by trying to fix the rotation. What the driver is, and I'm going to geek out just for a second here. When we have a neutral spine, when we side bend to one direction, our spine naturally rotates to the opposite direction. Okay. It's neutral spinal mechanics. And so fixing the rotation isn't going to solve it. You've got to fix the side bending. Then that will cure the rotation. Okay. And it's really easy to fix. But the question, if we're talking about root causes, is why is this pattern occurring? And so this goes back to another deep reflex that we have in our body called the trauma reflex pattern. So we're all born with this. If you watch YouTube videos, you can pull it up and you'll see someone put a baby's foot down on the table and the baby hikes the whole side up to get off of that stimulus, right? And so we're hardwired to pull this pelvis up to get off of some stimulus that is unpleasant to us. So then if we have a history of maybe an old ankle sprain or a knee issue or a hip issue, what happens is that your brain is slowly causing you to go into this side bending pattern to get off of this. Even if you have resolved that, your brain doesn't know, because it's an unconscious pattern. Your brain doesn't know to fix this again. It's got to be taught to let that go. All right. So
Mm,
invariably, when we fix something here, I often will deal with whatever old injury led to that pattern to happen in the first place. And so with unilateral sports, you'll often see the side bending pattern issue emerge because even if they have no history of injury, you have unilateral based history of usage that
yeah.
your brain is going to hold on to, right?
Yep. No, that certainly makes sense. And when you're talking about correcting that unilateral dysfunction, that kind of that hip pulling up and the rib cage kind of pulling down, what are some of the tools that you use to help correct that? I'm suppose, like you're
Yeah.
mentioning, that's kind of a neurological issue as well. How are you addressing that?
Yes. Okay. So great question. So there's a really easy way. In fact, all of your listeners can fix it in about 10 steps. And I'll show you, not 10 processes, but 10 literally walking steps.
Okay.
And I'll
Yeah.
show them how in just a second. But what's important to understand is that even though, first of all, I want your listeners to know whether they have it or not. All right. And a really
Hmm.
easy way, especially with people over 50, the really easy way to determine this is just have someone take a picture of you with your shirt off from behind. And, I wish you could see my screen because I'd share with you, I have tons of pictures of patients with a bigger crease on one side of their back than the other. And that is the sign of a side bending problem. If you see a crease on one side of your back and less of a crease on another, then you've got a side bending problem where that pelvis is higher and the rib cage is lower. Chances are the side that you see your crease on is going to be the side where you have some old injury that you've been wrestling with or wrestled with when you were younger or something like that. All right. So now that's how you can tell whether you have a side bending problem. And the older it is, then that crease becomes more permanent because your skin is deformed to that crease.
Mm.
So even if you've fixed the pelvis and rib cage, the crease will remain because that's just the way your skin is shaped now. Okay.
Mm.
Now, if you just hurt your foot yesterday and you've been perfect all up until yesterday, you will not form a crease because your body has not adapted to that posture yet. That's when I go in with my hands. I always check everyone with my hands to see whether this is happening, whether they have a crease or not. Okay. So now let's assume in this skeleton, this is the right side. Let's assume the right side of your pelvis is higher and the right rib cage is lower. So I'm going to show you how to get rid of this. All right. All you're going
Okay.
to do is you're going to put your right hand up in the air and you're going to walk just 5 or 10 steps. You step on that right leg. What we're doing is by having that, we're preventing the rib cage from falling down. Okay. So you don't have to walk like this and really side bend to the left to fix this. All we're doing is not allowing the right side to collapse. Right. Even though you're not aware that it's collapsing, if you have this pattern, then it's been happening unconscious. So holding the right hand up 5 or 10 steps, bring it back down, and that will correct it.
Okay. And is this something that you would encourage folks to make a common practice of? And you had mentioned I'd like my people to do this 3 times a day as opposed to
Yeah.
one superset. And yeah, so is that something that
Right.
people would just incorporate into a general practice? Well, a couple times a day, I'm going to get up, I'm going to walk, put a hand over my head.
Well, let's say for the first week, you're going to do this every time you stand and walk. All right.
Ah, okay.
So
Yeah.
the point is because we need to break that pattern, right? And you
Mm-hmm.
won't do it if you just do it 1 or 2 times a day. This is a movement habit dysfunction. So the point is here, you're not going to walk like this for the rest of your life. Okay. That would be
Right.
ridiculous. But what we're going to do is take a few steps. You're going to lower that hand. You're going to feel that the rib cage waist remain long, just like it was when the hand was up. So now you're going to get your attention to this area that you're correcting, and you're going to solve this pattern that has been occurring and start controlling it like this. So that is a normal looking walk, but you can't do that unless you start with this first, because that's showing your brain what it needs to adapt
Yeah.
to, right?
Let's go back to that neurological connection you were talking about, right? That there's a couple things
Sure.
at play here. There's that physical, there's the muscle and the tendon and the bone and all of that at play.
Yes.
But there's also that signal that the brain is sending there. And I think that gets missed a lot of times as people are trying to correct pain. If you've got this, maybe like you mentioned, an old injury in say one leg, which is causing some sort of compensation in your gait now and the way you
Right.
move. And especially if that's over years or decades, then there's probably going to be some work to be done to get that undone, right? To get you on your way to moving pain free.
I will
So,
tell you, it is so much easier and faster than your listeners are probably thinking. I mean, that
well,
woman with
yeah. So
15
talk
years of
about that
back pain
because, yeah,
solved in 3
right.
days.
So it
So
takes, and you had mentioned that a couple of times, right? If I've been dealing with pain for years and years and years, and you're saying, hey, I had this person come in and pow, a day or 2 or 3 later. So the expectation then is we can get some immediate relief from some of these techniques. Now, do I
yes.
practice these techniques for the rest of my life in order to continue with this relief, or how does that work?
Yeah, because don't think of them as techniques. Think of them as
Hmm.
teaching yourself how to use your body better. Because that's
Yeah.
really what you're doing is you're teaching yourself how to use your body. And so here's a little thing that your listeners can think about. So everyone at home, lace your fingers together as if you're praying. All right. So you can do this too, Kevin. So
Yep.
go ahead and lace your fingers together. And there's your normal way of doing this. So look at which thumb and finger is on top. All right. Which one?
Hmm.
Is it your left or your right, Kevin? Which one
My
is for
left.
you?
Left.
They're left. Okay. Now you're going to undo the fingers And without looking, you're going to lace your fingers back together again with the opposite thumb and fingers on top. That's a little
It's
difficult,
an
isn't
awkward
it?
feeling. And it's awkward.
Yeah. And now,
It just doesn't feel right.
and you
Yeah.
had to look down and you had to look down to see whether the right thumb and finger was on
Yeah,
top,
I
right?
did. Yeah.
So what we're doing is changing a habit. What if,
Yeah.
and so your brain is going to say, oh, it's different, right? And it's awkward. And you're going to interpret that, or you're going to translate that into saying it's wrong because it's different than my natural habit of doing something. But your natural habits of doing things are why you're having pain. Your brain isn't interested with whether your natural habit is causing pain or not. It's interested in getting from A to B the quickest and easiest way, which is the way that you've always done it. That's what your brain is interested in. Your body and joints care more about the pain that that's creating. And they send that signal to the brain and say, hey, but something's hurting. And the brain said, I'm sorry, this is the way that we do things. So
Yeah, that's very interesting.
this little exercise shows you that, okay, there's nothing wrong with me putting my fingers like this, but I'm judging it as wrong because it's unnatural. And that is the key to changing this stuff. If it's feeling natural, it's probably hurting you. That's why you're having chronic pain, because you're not getting the signals yet to change that thing, because your brain's saying, no, this is the way that we do it. This is the way you've taught me to do this. This is how I'm going to do it. It's time to change that. And
Yeah,
so
it's time to
pain,
change
think
that.
of this
Yeah.
as it is time to change that. And so
Yeah.
think of pain as your movement habit is like a hammer that you're hammering things. And it's just like if you were hammering your thumb and saying, okay, I know I'm hammering my thumb. When is the pain going to stop? Well, the pain
Mhm.
isn't going to stop until you stop hammering it, right? So that's
Yeah.
what your movement habits are doing to your tissues. And that's what they're trying to tell your brain. Hey, I'm having pain because you're hammering. I'm hammering myself. Can you help me change this now? And your brain doesn't know how to do that. That's why you've got to be taught how to do this. It only knows one way of moving.
Yeah, that's very insightful. I hadn't really thought of that. Clearly, there's a mind muscle connection, right? Your brain is sending these signals and telling things to lock up or to compensate or to do all these different things, right? And for those of us that have done that
Yes.
forever, but just that simple exercise, like you said, of interlacing your fingers is a very good way of saying, oh, okay, so I can see how my brain is very naturally wired to do what is most comfortable and what's most natural, right? And probably what I've been
Right.
doing. But if I've
Right.
got chronic pain, doing what I've been doing is not serving me well. So that is very,
Correct.
very insightful in figuring out how we get to back to the beginning, how we get to the root cause of all this pain, and
Yes.
ultimately how we correct it, right?
Yes. And
Well,
don't forget that there is a judgment, an unconscious judgment of that new
mm,
pattern, that it's wrong because it's
that it's wrong.
unfamiliar. We don't do
Yeah.
things that are unfamiliar. We're uncomfortable with doing things that are unfamiliar. But that's the thinking, that's the logic, right? But you've got to break that logic sequence. Unfamiliar is probably what's going to solve your pain.
Unfamiliar is probably what's going to solve your pain. And yes, I think after this discussion, we've been talking here almost an hour, I can certainly see that, have a much better vision of kind of your message here. And your whole thing, as I was researching, getting ready for this podcast, is exactly that, right? Let's not treat the symptoms of pain. Let's treat the root causes of pain. And that's a much different discussion than, like you said, getting acupuncture or getting a massage or getting an adjustment. This is going back
Yeah.
to the way you
So
live your life and how you're wired.
right. And I want to address this. That I can't think of a practitioner that doesn't say that they're solving the root causes of pain. Everyone says that they're causing the root causes of pain, but are they really the root causes of pain is the question. So,
Yeah.
uh,
No,
because
I'm with you
no one's
there.
going to say, oh, I just treat symptoms. I'm sorry. I
Yeah.
don't address root causes of pain. Everyone thinks that they're addressing root causes of pain. So hearing a practitioner say that is not the deciding factor of whether they're solving root causes of pain.
Yeah.
They're solving what they think is the root cause of pain. And so that brings me back. I just want to tell this really short story. When I first started learning this connection between movement and pain, I made friends with another physical therapist who was taking the same courses. After we took these courses, about the fourth one, I said, "Hey, how's it going?" He said, "Eh." I said, "What do you mean, eh? This stuff really works. I mean, my patients are just, getting so much better faster." He says, "But I'm a manual therapist. I don't really use this kind of stuff. I might use it for a home exercise program or something like that." And that's when I realized that we all, as medical people, as attorneys do this, all careers, we filter information about how we're going to do something based on our belief system.
Yeah.
And so that belief system will filter out useful things that if we don't believe that it will be useful, then we won't allow it to come into our belief system, especially if it causes us to rethink our whole belief system, right?
Yeah.
Oh, this doesn't
Yeah.
fit with how I'm thinking, so I'm not going to let that one in. So this is why I wrote my books originally, is because once he said that to me, I thought, oh my gosh, all these people are suffering chronic pain because their practitioners don't believe that movement can solve their pain or change how their bodies, or it seems like it's too much work for them. Right. So that's
Yeah.
why I wrote my books. And so when I talk about root causes of pain, practitioners, it's not that they're wrong. They wouldn't be doing what they're doing if they didn't have success, but they could have more success if they understood these kinds of concepts too.
Yeah, I'm with you 100% on that, and I think that the litmus test can be this, right? And I see this, and I don't want to pick on chiropractors, but I'll just use this as an example. I'll have somebody who says, "Oh, they'll come into my practice. Oh, I've dealt with back pain my entire life," and I said, "Well, how are you addressing it?" "Oh, I go to a chiropractor, and I go every week. I get an adjustment." Clearly, they're getting some relief. That's why they're going and spending that money. But if they don't go every week, then the pain is still there. And so clearly that chiropractor is, I don't think they're guilty of malpractice there, but to your point, in their system of belief, perhaps they are treating that person as the best way they know how. But if your treatment for chronic pain causes you to go and get a shot every month or to continuously manage it, you're probably not addressing that root cause, right? So very, very well said.
Probably,
Now,
but
Rick, go ahead.
it's not just chiropractors. I don't want to pick on
No, no,
chiropractors.
no, no. I'm just using
Lots
that
of
for an example, and I didn't
PTs,
want to throw the
you
there's
know,
chiropractors
yeah,
listening to this going, "Hey, why do you throw
yeah,
me under the bus?" No, yeah, they're great
yeah,
chiropractors, and just like
eh,
any practice, and not so great ones,
right,
right? Yeah.
exactly, yeah,
Yep. 100%. Well, Rick, you had mentioned your books there a couple of times, and now folks that are listening to
hmm
this, I'm guessing, just given my demographic, we're probably resonating with a lot of folks right now. Folks are saying, "Oh crap, I've had this back pain all my
hmm
life, and I've done X, Y, and Z, or I've had this knee pain, or I've had a knee replacement and it's never been the same, or etc."
sure,
How can people connect
yeah,
with you and potentially work with you?
yeah. So I wrote my books starting about in 2009 is when I published my first book, but that was before I owned my clinic. And if you remember, when I owned my clinic, I got to see volume and see how patterns of things were happening in just about everyone. It's just manifesting in different types of aches and pains. And so that's when I decided, because when I rewrote my back pain book, it took me 3 years to rewrite that thing. I thought I cannot take 3 years to rewrite every one of my books. So that's why I've created these downloadable home programs, is because they're much more current and easier for me to adapt and add and change things as I learn more. And I'm always learning more. But the downloadable home programs would be their best bet. The books are good because they explain in detail what's going on, but the home programs are efficient at solving a lot of problems. So they go into the exercises you would do just to fix those tighter weak muscles. But it also has videos on the habits that you need to change and how to change them. And then I also feature taping techniques to bridge this lack of function that you have, to help you function better until you solve all these problems. Then you can stop taping. So those are all found at www.fixingyoumethod.com. And if your listeners type in "fixing you," all one word, into the coupon code, they can get 20% off of their purchase. if your listeners happen to be practitioners, whether you're a personal trainer, physical therapist, chiropractor, doctor, I've created an online training program to teach you how to think of pain like this. And that's at healpatientsfaster.com. And again, if you type in fixing you, all one word, you can get 20% off of that as well. And then finally, I have some free stuff as well as all of these programs on my main website, which is rickolderman.com. So you can find everything I have, including some free stuff there, if you like.
Fantastic. Thank you for that. And what about social media? Are you active on Instagram, Facebook, places like that?
I have someone help me with that. So that I
Fair enough. Yeah.
really, I'm an email person. I'm just a dinosaur. I'm used to working in my
Right.
cave, and
Yeah. Yeah.
I will engage somewhat with those social media outlets, but really, if you want to contact me, you just send me an email,
Okay. So
rick@rickolderman.com.
right on.
Yeah,
Okay.
yeah. And I
Nope.
appreciate
Fair
those of
enough.
you who are on those and want to like something that I've put on there, but I just don't have the bandwidth to manage all of that.
Fair enough. Fair enough. All right. And folks, I'll throw all of that information into the show notes and you can find that there. So, Rick, I want to thank you so much for coming on the show today, sharing your passion and your experience and your wisdom with us. I think we got a lot of quality content here in a short amount of time. Really appreciate you coming on the show and wish you all the best in all your future endeavors.
Well, thank you for your insightful questions too, Kevin. I really appreciate how you're a great listener and interviewer. So I really appreciate how you drilled down on a lot of things. So thank you.